A woman has to feel comfortable really talking about anything with her OB-GYN because she's talking about some of the most intimate parts of her life. So she needs to feel comfortable and trusting of her doctor that she could tell them anything or ask really any question, because this is the place where you get to ask the questions that you don't necessarily get to ask anywhere else, and you have to have a comfortable relationship to have the security that you can ask those questions and not feel judged or not feel like you won't get factual or correct answers. So when I first meet a patient, part of the visit is getting to know their medical history, of course, their surgical history, getting to know the things that you would find in a chart. But another important part is getting to know them as a person and finding out what are their priorities, what are their goals, what are they hoping to get out of that visit, what do they want to get out of their care, because there are so many things that anybody could address in any one visit. It's really important to know what somebody's goals are and what they want to get out of it. So we've all been on the patient side, and we've all been on the doctor side, and they're very different feelings. But if you can picture yourself as the patient and how you would want to be treated and how you would want your physician to care for you, then you can give that same kind of care back. It absolutely is a team approach. When you're taking care of any patient, and particularly prenatal patients who you're going to be seeing frequently and who might go into labor at any time with any person on call, you have to have a team of people that you trust. So even if you're not the person there, you know that the person taking care of them is going to be giving them excellent care. There are many different ways that a baby can come into the world, and I think part of the skill of this job is being flexible, because you might have the best intentions and you might have a great plan set up, but babies choose their own path, and so you have to be willing to adapt to that plan very quickly. I love to cook, and I'm just moving to this area, so I'm excited to learn more about the farmers markets and the available local resources for cooking in this area. I also love to travel. I love to read.